Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Mechanism of action of all the anti-anginal drugs. And some of the anti-anginal drugs increases cyclic GMP. If they increase the cyclic GMP, what happens? Once they increase the cyclic GMP, this cyclic GMP will cause the dephosphorylation of the myosin. This causes dephosphorylation of myosin light chains. Now, because of the dephosphorylation of myosin light chains, the myosin and actin interaction, which is important for the muscle contraction, is not occurring. So because it does not occur, so as a result, this will result in uh, relaxation. Because of this results in relaxation rather than contraction. So the drugs which are important in increasing cyclic AMP are, we have drugs like nitroprusside and organic nitrates. These nitroprusside and organic nitrates will release nitric oxide, and these nitric oxide is responsible for increasing the cyclic GMP levels. Then, second mechanism of action is by decreasing the intracellular calcium. Whenever there is decreased intracellular calcium, calcium is actually important for activation of myosin light chain kinase. So because of this decreased calcium, there will be no activation. There is no activation of myosin light chain kinase is not activated. Now, because there is no activation of myosin light chain kinase, this will result in relaxation of the smooth muscles of the blood vessels, and because of this will result in vasodilatation occurs. Okay, because of this vasodilatation, there is also it will also reduce, because of the reduced calcium, this is in the muscles, and because of the decreased calcium influx into the cardiac muscles, because of the decreased calcium influx, there will be relaxation of the cardiac muscle fibers, reducing the rate and contractility of the heart, and this will result in decreased oxygen requirement also. So whenever there is decreased oxygen requirement, obviously the angina effect will decrease, because angina there is blockade of blood vessels, thus causing decreased blood supply to the distal part of the heart, where the distal part of the blood vessel blockade. So as a result, there will be decreased oxygen supply. So this, by decreasing the calcium ion, they will also cause decreased oxygen requirement. So the drugs like beta blockers and calcium channel blockers act through this mechanism by decreasing the intracellular calcium. Then there is one more mechanism where the drugs will stabilize the depolarization. They will stabilize it or prevent the depolarization of the vascular smooth muscle membrane cell. So they will stabilize the electrical activity of the heart. So this is mainly done by increasing the potassium channels. So these potassium channels are increased, and the drugs which are acting through this mechanism are nicorandil and minoxidil, which are potassium channel openers.
thank you and thank you for watching.